Advanced Dental. Beautiful smiles done well.
When someone says I have a beautiful smile, I immediately recommend them to go to Advanced Dental.
When you walk in, you just feel so comfortable.
I got 2 fillings done, and it didn't hurt. There were no needles involved, and it was very quick and easy.
With modern dentistry, as Dr. Gaff has, it's completely painless.
Excellent cosmetic and family dentistry in a comfortable and relaxing atmosphere. Free take-home teeth whitening kit with any cleaning.
And today we have Dr. Brad Labrecque.
Labrecque.
I'm sorry, I pronounce it as 3 different syllables.
It's done so often.
And I apologize.
No problem.
You're with Advance Dental. And first of all, where are you folks located?
We're located in Aliso Viejo in town center.
Okay.
It's above, there's the building there where the Bank of Montreal is. Bank of America, pardon me.
Okay.
And there beside us is an urgent care center. And so it's a small practice.
Okay.
It's a small boutique practice. Okay, it's got Dr. Nazita Gaff as our main practitioner, and then we work well with 2 specialists, a periodontist and an oral surgeon. So our whole intent is to keep have a small practice, and when our patients come, so we have a good team to look after them.
Okay, very good. How long have you been there with them?
I've been with them for 3 years.
Okay, I know that nowadays, just like with MDs, that in dentistry, quite often you specialize as well. And so, do you have a specialty there? Like you might be doing this, where Dr. Gaff might be doing this, or you all?
Oh well, Dr. Gaff is the main practitioner, and
Okay.
I'm not too much hands-on anymore.
Okay.
I'm kind of been doing this a long time, and so
Mhm.
I'm trying to get on the backslide and trying to retire out of this business just a bit. Dr. Gaff's got about over 20 years of experience.
Okay.
And so what our practice has tried to do is to involve, we bring in some lasers in there, and lasers you kind of go, oh my God, what's that all about? Well, what a laser dentistry can do, and that's kind of our niche that we're working with, is it allows us to work on our patients with the least amount of after pain or during the pain.
Okay.
Because nobody wants to go to the dentist.
No.
Okay, first of all, bottom line, nobody likes coming to see us. And I hear that like 100 times a day,
Yeah.
right? So what the lasers, in particular what we call as a water laser, what it allows us to do is do many procedures, okay, at a stage much earlier that we could treat with traditional dentistry. So the end result is that we can do a better job, less painful at the beginning of the procedure and afterwards as well. Like think of a cavity. If you have a small cavity in your mouth, we can turn around and treat that decay without even have to give you an injection.
Oh, really?
All right. So if we can avoid, I mean, do you like getting needles, Ken? No. Right.
So, the water laser?
Water laser is called, yeah.
Is that, in a sense, replacing the old drill type
You know,
of thing, or what does it do exactly?
The laser itself replaces the drill.
Okay.
Okay. But it also replaces things that we as well as, let's say, if you're going to get some surgery done, and there's this thing called a scalpel.
Right.
All right. It replaces that.
Okay.
And it allows us to treat gum disease. Well, you know, that's another. If people go to the periodontist or gum specialist to get their gums treated because they're losing bone, okay, because they have an infection in their mouth. Well, what the laser does is helps treat that infection without having to be so invasive, we call it. It means that we don't have to pull the gums away from the bone to clean it, right? And by doing that, of course, it's way easier on the patient itself. So, and we get rid of the disease that's starting. And actually, there's something new that's come up, is that when we used to think when we had gum disease, we actually lost bone around the teeth, right? With laser therapy now, and by treating with laser therapy, we're actually getting that bone to come back up again. So we can actually extend the life of teeth. If people are, let's say, haven't looked after them that well, if you come in and get it treated properly, then you will be able to keep your teeth longer.
All right, very good.
So it's a very, very good technique.
And what about, we've heard lately, or over the past couple of years, the new types of implants and things like this. I mean, there's been so much advancement.
The treatment I mean, if you're wearing a denture right now, one thing, you don't have to put up with that anymore. I mean, dentures just don't fit your mouth.
Right.
And no matter how good we make them, no matter how we do our best, there's still something foreign in everybody's mouth. So it gets food underneath it.
Right.
Right? They slip, they slide, and I'm sure that everybody who has them is understanding that. The techniques that we have now we're able to place implants. Let's say for a full mouth, 4 implants in the top, 4 implants in the bottom jaw, and have your teeth fixed in your mouth, so you never have to take them out.
Very good.
You can start to chew your heavy meals again. Everybody says, well, can I chew corn on the cob? Can I have a steak? Well, certainly. I mean, at that point in time, you can do that. But it's not just for a full mouth that we can do that. We also do it for patients who are missing 1 or 2 teeth. Okay, so you never have to have anything that's kind of removable anymore. You can always place it in there and get it done. And our team works with, we have an oral surgeon in our practice, and we have a dental technician. And there are some instances where if your teeth are broken down so badly that we can actually remove your teeth, put the implants in and the bridge in the same day. So you don't have to walk around with with something that's loose while in that healing period. The techniques allow us now with implant technology is to replace the teeth in the same day.
Wow.
All right, it's a fabulous technique. It opens up the doors for so many people who have been worried about it. So that means you can come in the morning, after all the preparatory work is done.
And the preparatory work is done in advance. But
It's
you
well in
measure
advance.
and all that kind of stuff.
We do molds. We actually take a scan. I mean, we're talking about when we do a scan. What it allows us to do is that we have a virtual model of your jaw ahead of us. So we're doing everything virtually on the computer. And so the dentures, the bridges are designed on the computer. The implant placement's designed on the computer. So when you come in and see the surgeon, you're sedated. Once you're sedated, the implants are placed. Once the implants are placed, the technician is there. The bridge is ready to go. We fit the bridge on, and you leave that day within a half a day surgery with a full bridge in your bottom or top jaw.
Very good.
And you can go ahead and start chewing the next day.
Not bad.
It's pretty amazing. It's pretty amazing.
Yeah, that is.
That's some of the newer technology, the newer advances in implant technology these days.
That's amazing
Yeah.
compared to how it was so many years
ago. And then everybody relates what they go to the dentist, what happened when they were 30 years, and they go, and everybody's got a story.
They don't need that. What's that stuff called? That polydent anymore? That glue?
Oh, the
or
Fixodent,
the Fixodent,
Polygrip,
Exactly,
and that
yeah.
sort of thing. And you
All
have to put
that
that.
stuff.
No, it's pretty. So anybody who does have that sort of thing, there's certainly some great options now.
Yeah.
And you need to speak to a good qualified dentist for that.
Very good.
Yeah.
So again, you're in Aliso Viejo, the town center.
We are.
Okay, so right over. Is that where the theaters are? It's right in that
It's in
whole
that.
area.
It's in that area.
It's a
there.
huge
Yeah.
area. I know
Yeah.
this.
The Bank of America is there.
Okay.
And we're up above that.
All right. And the number is 949-362-8523.
Correct.
And people can call to see if they, their insurance needs. I know there are some Medicare plans that carry dental.
We take all the insurance plans,
Okay.
and we help you.
Very
You
good.
make sure you use your benefits properly.
All right. Very good. Dr. Lebrecq,
Very
did I
good.
do it right?
Yeah,
okay.
awesome. Good.
Very good. Good to see you. Nice to meet you.
Nice meeting you
It's
too.
been a pleasure.
It's been a
And
pleasure coming here today.
I'm sure we'll see you again. All
Well,
right. We'll be
okay.
Take care. We'll be
Bye-bye.
right back.
Awesome.
Advanced Dental. Beautiful smiles done well.
When someone says I have a beautiful smile, I immediately recommend them to go to Advanced Dental.
When you walk in, you just feel so comfortable.
I owe her my charming smile.
I'm always so comfortable, it never hurts, and now I love coming to the dentist.
Excellent cosmetic and family dentistry in a comfortable and relaxing atmosphere. Call us today and receive a $50 gift card for you and your family or free exam and x-ray.